Kushe on Akabo. Once more, welcome to the WBBPG Gentri program. We are Salomon, they will learn Boku book, and they bring this program to Una, and they will learn medicine, various aspects of medicine. Some are doctors, nurses, public health officials, and so on and so forth. Me name is John Fuller. Me not to a medical person. Yes, I do medicine. Just a little bit. When I first go to uni, but me not to a medical person. Me a business IT consultant, specialized in cybersecurity. Okay, so me own role now, so I'm a host, but also I help the team for make sure say they reach you uninterrupted, i.e. via digital channels. Okay, today we deal with cancer awareness with Dr. MSI Kamara, Mohammed SI Kamara, and I am present to today. Okay, for one who been joined before, when I'm gonna say we don't they present now for a long time. Today now we 91st session and a cancer awareness something on Sunday, the 26th of April 2026. And Dr. Kamara and they present, and we'll get the WBBPG Gentri team. We go there at hand for answer any questions we wanna get. Do you have a fumble them? I just need to say one more thing. The reason why I cannot say this before the recording start, and for make sure say it be part of the recording. The advice we give are not to personalize advice, like general advice of things they want for look out for if something wrong, when for go to doctor or when for look after an house. And if you go to doctor, whether the kind of thing for ask, then kind of thing and deny with the Guinea. If we story similar to you, not similar, no more similar not to you specifically we talk about. However, if you get problem, you ask, you go try for answer. If not general advice, the thing relates to. But if now you personally, we're not going to give you advice on live. The reason being we not get you medical records. And if we give you any advice, you go do anything wrong, then people also then go risk for loss their license. Okay. So they will give personalized advice. If you get anything personal, we will ask dear. There's a number at the end. I will say reach out and we go try for talk to you and try for understand exactly what's your problem and try for see the best advice we then will give you. But anything personal, we're not going to give live. But to say we'll not go get the answer or we get the answer, but because we'll not get you medical background, we'll not go do that. Okay. Okay. About the group, we not know they get paid now. We're on a voluntary we do more because we see say we people and they die, innocently, they suffer innocently for something they don't need for. Now make we do so dear, if anybody gets any way for like this message get to people in our tongue, we happy for give the materials, the content for free. We don't need anything for that. We just want to try for help people. That's all. We don't begin this thing just before COVID. We still they go on within 6 years now. We still they go on. We just become 6 years. And also they are I forget to welcome everybody back after we break for the festive what they call them, the holy months. We will mark Ramadan and Lenten season. But we are all welcome back. Okay. Now, look how they say the session where they get recorded, they go there on YouTube, Facebook, and other social media handles. Once it get downloaded, we put on there, we will share the link for let people and get the opportunity for view. And if you want to go on your own, while they talk, while they do the presentation, I will most likely put the links to YouTube and Facebook. But also, if you search WBBPG on any of them platforms, then you will be able to see all the sessions they will be done do before. Like I say, we don't do 91. Okay, yes, not to all day because some of them will be lost. Something be happened recent few years back, so we'll be lost some, but most of them they online for you for see. Okay. Now, like they say before, if you ask question for who we brave, we go show face. But some man they're not brave, they go do them by chat. So the first thing most of them are going to see this because some man are in tablet or in phone. They look on this, they view this program. You go see 3 buttons in the night. If you press down, you go see this bit. You can use the chat. For talk to me, if you want text any message, it will be like WhatsApp or Facebook. Okay, you do one, or you can ace your hand up. If you brave like me for show your face and your background good for public viewing, you can ace your hand up, and I will count to you. Dear, if you let me do all of this, just ace hand up physically. I will count to you. But if I don't count to you quick, I mean I ignore you. Okay. Pretty much that's it. Like how they say, that's the number there. If you want contact with you, a big no call that number there. Most likely, we'll get somebody for answer. The one on your personal phone is difficult. That they will know me personally. They don't say I'll have a big sickness than they for pick up phone. But it's because I don't say I ignore people. It's just that I can get meetings for attend or talk to other people or something. So I will say reach me on WhatsApp on that number there, or you get to me by email. Okay. But apart from that, that's all for me. I will keep quiet now. I will mute everybody. But at the end, like I say, when I will get enough time for ask any questions. When I want to ask, we get people then we are GPs, pediatricians, we get gynecologists, we get public health, we get mental health nurses, various people that we get within the panel. I believe, say, no matter what your question, somebody must be within the panel will be able to answer a question. If we need to answer, I'm going to take them away. Okay? I wish you now all the very best. We'll stay on and listen to Dr. Kamara. Thank you very much.
Hey, Leonardo, thank you so much for I left all with you to do for can join.
Dr. Kamara, unmute yourself. Thank you.
Yeah, I just realized. Leonardo, thank you. When I can join me, with the hopes we'll be able to talk about this important subject where they cause problem in the whole world. No matter how that you be, this thing can touch anybody. You can be poor, you can be rich, as we don't find out. You can be young, you can be old, you can be man, you can be woman. Definitely, this thing they around, and the Hamburg people. So now make we say, where would they come back after we don't go away for the Ramadan and Easter, and in fact Lent? We decided to let we come with something we're very, very important. We need the peak without the fall part, you know. Which make I tell you that this, I get one guy we come to me. In fact, not the guy come to me, then just give me in notes them, say make I talk to them. Because the man they worry. Now, I don't know which have been the problem, but he come in with belly heart. Can you imagine that? They examine them, then do investigation, then find out say the pendant at the right, and then send them for a scan. When they go do the scan, they not send them the result. Now that result they wait for. So me look at the result now, and me now get for talk to this man. So when I ask, I say, because I can do, I say, waiting at the problem, waiting you do worry about. And I say, you say, all man they worry about cancer. I say, why? You they worry about that? He say, yes. I say, waiting, they say, because once they say you get cancer, now die road you there, a death sentence. So I just want to know for just think about that. Because I actually tell me, and this now which man or not to black man. So now the situation there. I think I need for introduce myself. The old man don't know but me. I mean, just want to tell you a little bit about this cancer. Nigeria will not bother for talk about because the name alone, the moment you hear I'm like that, all man they worry, all man they feel say, oh, and that. Well, I can tell you otherwise. I don't know how much man know say cancer the zodiac sign, that's the way they do horoscope. Yeah? And they do the horoscope, they know that within a cancer, one of the signs them of the zodiac. And then of course, the Latin word. But what do you mean? It come up from the word crab. So we hear about crab loss and all that. Well, that's it. A crab, not in a cancer. Yeah, believe it or not. The first way they found them, be over how many 100 years ago? Maybe over 400 years ago, we didn't find them in Egypt. The first people who found them are Egyptian. It's important for make people understand. So you see that arata, they call a mole arata. He catch cancer like that. Cancer never catch him. You know, I don't know why, but the African in the film that arata day. Besides that, we are go really, really be happy for you. They say, means when they say you get cancer, that means now die road you there on a death sentence. No. If you detect them early enough, then clearly likely say you can survive. We will get to know about that how. You see, because when cancer then they run their families them. But then a small type number, very small, about 5 to 10%. Yeah. Most of them are because of what they do in real life and because of the environment who they. Usai smoke they, usai the fumes then they, usai people then they do them walking at the sun. All them things then they can actually cause the cancer. So 90% to 95% now because of what they do, and 5 to 10% now because of what they now we gene them. But look at that. For confirm that, Then we found we like for go tan them body. Some man they use injection, some man they use tablet, some man they go to the saloon then. Well, I tell you what, the number of skin cancer cases them from people and where they tan them body, where they did at the saloon, then definitely more, far more than the one then we get lung cancer, believe it or not. Unbelievable. Almost 500,000 every year in America no more. Yeah? And the cancer itself, not to say that one, not 200 types and more. But from the 200 type, you get 50% where you go for prevent, where you go say, this one, I no go get them because I do such and such and such. And of course, if you catch them, unfortunately, now only 50% now then go possibly die. So out of 20 million we will get in the world, about 10 million go die. And out of the 10 million, another 5 million go save if we do what we need for do. Yeah? Important for them to know that. As the age they increase, like the Western world, as the age they increase, now so the chances that they increase for the possibility of getting cancer. But you know, means that because you get cancer, it means that's the end of the world. No. Most of the cancers them now, if you catch them on time, then definitely get survival rates really high. Yeah? And of course, if you look at the deaths them, the people who they die, the only way you can avoid, you find out, say, from doing what you will get for do, about almost 4 million, shall we say, between 2.5 and 3.5 million, you can avoid then die then they. But you see, they die the way they happen, most of them they happen now we don't country them. Yeah, like we have the continent, lower and middle income country them, another LMIC. And then definitely they die more, even though their own rate of cancer less. So the one that we so far we don't survive about 28 million people around the world. But look at this. Mrs. Enobi know this past where I see them. For the woman them, the left breast in cancer, it common pass the right breast in cancer. I don't know how most people let me know that. Mrs. Enobi know that. And of course, the skin cancer we then call melanoma, where the worst one that the one way not even get, you know that black spot we can do at the body, we people like for go sunbathe and go holiday, go begin sunbathe and all that. Well, people will get that boku black spot then at the body, then likely for develop that well and get melanoma. In fact, one of the things we didn't talk about, I don't know how true, but I say that melanoma and Bob Marley been get in toe, where you know, be no say get them because waiting you know, the white one, they are going to color. And before they see her now, it don't spread, and that's the end of it. So there you go. The crab, and then the zodiac. So, what's in a cancer? Well, like how you know the body, and give you a simple example. You get different organs, and they change themselves. For example, the blood. I will not talk about this. The blood, they change itself under normal circumstances once every 120 days. Yeah? So, about 4 months, every 4 months. So 3 times a year, the blood, they change itself completely, like how the snake, they change in kanda. So, something they way, now they manage that, they police them, so that, you know, go beyond, so that you go do them 4, 5, 6, 7 times. Yeah? Now, in the case of cancer, that police day, now you're able for control how this thing they change, how this thing they able for multiply. Yeah, when it's supposed for die, you know they die just to continue no more. Now because of that, now you make the person they get this cancer. Yeah, so we all get this system of body where they stop this thing, they control them. If for begin and if for end, beginning for end. That's what they do until the time reach for left this world. Yeah, so when this thing become abnormal because you know they carry on, nothing need for stop them, like when the brake fail per motor car, then obviously something get for happen. And if it happen, the organ they when they nearby, then they bug. If you watch, you go see. If you see this one, this picture now, you go see. Now, yeah, we not do nothing yet. The moment they begin grow, you see them. Now they invade part. They go to this part, and then the second stage you go see this now, yeah. And then by the time you reach the third stage, you will see them there outside of the skin. Of course, by the time you reach the fourth one, well, you don't go inside the other organ. This one, like where you get cancer of the bowel. We'll talk about that later. But then this, that's where they begin. Like where you get, that's what they call polyp. We don't know, sometimes small growth. They begin grow. If you catch them on time, like for example, if you're in the family, by the age of 50, then go call you for let you go do a screening. So man, now if you're not getting in the family, then go just send you the kit. Like something then they send you like where you put urine pan. Small one will get, you know, you take the poo, take the motion and put them inside, sample of them, send and go na the envelope, then go process them and then come back to you and tell you whether anything did or not. And what they go tell you is whether they see blood or not. If they see blood, then go call you for let you go get colonoscopy. That's what they call it. If not down the other side, na the left side, na sigmoidoscopy. That na the one with people like S. Now the big bowel, the big gut. If na the whole of them, in the surveillance, then they go through. The first one when the sigmoid, it go take 20 minutes for do, whereas the colon one go take 1 hour for do. So when they see them kind of thing, yeah, you can try for either cut and come out with the laser and let it not bleed, and then go do biopsy, send and go to the lab, for them go see what thing that the thing really happen. But as I tell you now, this thing, it not mean say because you know they pray enough, now make you get cancer. No. It not mean say because somebody go swear you, where you go sometimes go thief in property or you go thief in coconut or in mango or something, now make you swear you get cancer. No. If it happen, not just coincidentally, not just by coincidence. It not mean say because you the rich, as I can say that one with the fly in that boat in the net, now make you get cancer. No. And not a punishment from God or from Satan or any of them people and we don't annoy. No. This just they happen, and when they happen, we don't know why they happen. But as I've been saying, it can happen to poor man, to rich man. We don't see them already. I don't go call them, but we know. We don't see the rich people and don't get them. We see them even famous people, footballer them, boxers them, king them. You know, they all we don't see. And they will poor one them. Sometimes they don't report them, but then still they get them. Man, woman, picking, old one, all man they get them. So I don't know how much people they know inside UK the 3 screening program that we will get for cancer. Anybody know?
We get cervical cancer screening.
Yeah.
We get bowel cancer screening. Hello?
That because the TT we sadly been dying of all days not being Mother's Day Sunday, now he die. This Jade Good. Now be actually highlight that day when that day now taking life. And so therefore they begin screening the picking them. The girl picking them in particular. But then find out say the girl picking them they find out say the girl picking them if they give them the vaccine when that go up against the cancer, then find out say then they get them from the boy picking them. Therefore they don't extend the program now to the boy picking them so that they go bring and condom. And so far they don't report say 25% reduction of the cancer rate per cervical cancer of the cervix when the human day. Any other one?
Bowel cancer screening.
Bowel cancer, like I talked already, it been there at 60. Nowadays, they bring a condom to 50. And in fact, it can be even early than 50 or younger than 50 if it is in the family. Yeah. That stool test they do, they can do 50, 52, 54, 56, 58, 60. They go to 70 and then stop. They do 60 now, they don't bring a condom to 50. Yeah. Instead, they save lives and they save people in terms of their survival, and of course, then they detect them a lot earlier than it been done before. The third one?
Breast cancer.
Breast cancer, that's it. Now the breast one, now in the issue again. They advise we sister them, we mama them, until they will picking them, so then check themselves every month when the period day and after the period day and all that. They always advise you for do that. And there's a way for do them. We're not going to talk about that today. We're just to talk about waiting necessary for let you be mindful of. So then they do, in fact, the cervical cancer one, then they do smear test, you know, and then they will still the bone picking. Then they do, I think every 2 years or 3 years, and they do that. In terms of the this one, when the breast, then clearly, again, if then they do again the mammogram at a particular age. I think now when you go 50. But if you then at the family, they can check you for these 2 gene them, we then call the BRCA gene, BRCA1, BRCA2, and for C. And interestingly, we need to talk about this, but man themselves can get breast cancer, and the immune is really bad. It was past the human immune. So therefore, if you didn't have the family, then supposed to check all the male, the man them, the woman them, to let them see if they get that in there or not. And if they get them, then they can actually do something towards that. Of course, we now know Angelina Jolie. This is not a secret. Your mama been get them, and so therefore, because you don't want to get them and in positive for the gene, you go do the surgery, both in the breast them, and then of course in the ovaries them, and pull them and now, thank God, it's okay. So, but we look at 3, we don't talk about already, but imagine that. This is the one way 9 and then they do anything about. And it annoy me. It really, they make me vex, because we black man, then we people of color, now we more prone to this. It's like we more likely forget this thing 50% more forget them than we wait people them, you know, and they're not going for do this thing because they say the test when they take for screen not to good money, good value for money, because what you do that test even called PSA, prostate specific antigen, it can go up, and it can go up for different thing them. If the person don't do strenuous exercise, like I know some man don't go to gym today, me say don't go. me PSA go don't go up, definitely. But if you go up, that not mean say I get up. And obviously, if you then go put the finger in the back passage for examine them, and a day up, it not mean say the person get them. That's not the problem. And of course, if the person do mama and papa business 1 or 2 nights before, he likely say he go up. And so, but you go put the finger in the back passage, he likely say for go up. Or if you get that, we then call prostatitis. So the prostate itself, not to say it's just big or you get the cancer, but it inflamed. And if it inflamed, it can go up. So a lot of things can go. And in fact, I think they can say infarct of the prostate gland can cause that. So plenty things can cause them for go up. So what they say here is, if they say because you go do the test, then the thing they up, and then you not get the sick, but then the thing they down in normal, but then you get the sick, then they say not to value for money. For me, they tell them, I don't know, we don't fight for this thing for over 10 years. Hopefully, then go anyway, because we know say big people, they don't get this sick, they all don't talk about them. You know, then a prime minister, then a king, then this and that, they all don't get this thing. And I know, say, by God's grace, then go for answer, and agree, say we need for screen using this PSA. Because the PSA, although powerful enough for say the person get them or not get them, because it can be positive and the person not get the sick, or it can be negative, but then the person get the sick. So what you get for do then is now for monitor the person, especially if you then at the family or the person don't begin see the symptoms. Now, if you don't begin feel the symptoms, then clearly, even if they test negative, they need for surveillance, they need for monitor, they need for make sure that then screen you, then do other test them, like a scan, MRI scan, PET scan, and all that. As long as you get the symptoms, you're good. But we reflect on that, and hopefully we'll get what I want for go. Oh, now the world, as you see, I've been telling you, 20 million. Now we get, new cases. Them amongst them, 10 now can end up for die. This now as early as 2022, about 4 years ago. Yeah, because of this, now big problem in the world. But maybe it don't go up, because then forecast say by 2050, until we don't do 20 million now, then the forecast they go up to 35 million. But not to just because of the fact that people need to do something. As I say, the more you age, the more likely you get for succumb, for giving to the cancer, as it were. And the different type there, as I say, over 200 will get. The problem is, the country the way USAI developed, development don't take place. You find out, then get high amount, very high amount of the cancer, but then they survive more than now we own country USAI, the amount of cancer lower. So we get less cancer, but more die or death. Whereas the opposite, in that country, which I then get higher, but then because of which they do, then they survive more. But not all because of the fact that we need to do what you for do. Something then they will go talk about, we actually they make we more likely for die. One pandemic obviously now limited facilities where we get now in country. Definitely things like detection and screening and even the operation them and the follow-up probably will not get much of them. But of course, as you see, the lung cancer then they lead the way, followed by the breast, now colorectal, the colon, whether the gut, and of course the back passage, and then of course, as you see, the prostate, definitely. And the one that we then they diagnose most, and because of that, now then they die more. Yeah, but as I say, 35 million people by 2050, and then they expect to happen. But if we do what we get for do, we can bring that back, because research they go on, people and they donate money and more ways of dealing with the cancer and treat them, they come on. So Here we are. As you can see, 20 million, 10 go die, but likely say 50% way in a 5 million go survive if we do what we get for do. As you see, the breast 9 they lead the way. You see, 230,000, and then you get the lung, then you get the rectum 190, then you get the prostate, where it's not too far away. Look at that, 180, 190, and then you get the Bεtεh, then you get the one for the human, the cervix. So it just goes to show you. Many people, a lot of people, they survive because of the early detection rate. Yeah. So as you can see in the right hand now, you can see this is not the normal cell, and when it become cancerous, we not for stop in multiplication. In you get if let the get boku, that's what it turn. Obviously, you can see the difference. Again, they show you now, normal cell then. There you go. It become cancerous. You see them. It changed completely. So we need people for the talk about this, like how we talk. So public awareness absolutely vital for we make people understand. Say, look, nobody not get for judge you. This not to stigma, not to because you not pray to Papa God enough. Now make you get not to because they witch you or then send which gun per you. No, this is something where they happen where Boku we don't know, but we know the one that we know. We know viruses, that we know the way of life, how they live with life, which would they do. Tobacco, cigarette, being overweight, the kind of life who they live, all the things that they can add to that. Definitely. Yeah? So you can see the normal cells, as they show you now, and so then they. This now when you look at the microscope, they see and so. Then if you look at them, you can see this begin change. Yeah. And then you multiply now, it's bigger. And then of course, once you don't get bigger now, they begin go inside. Yeah. When you go inside, that's when you begin they go to the other tissue them, like inside the muscle, then the bone, then they and things and all that. Yeah. So important for let we know say the earlier we for detecting here, the better. As you see, pollution, now the world, na risk factor, infection there, as we say, inactivity, we not the exercise enough, the diet being poor. Then they say I see somebody they show Pamai where them buy in a one shop with a chemical. Now red paint, now then take for maker. Imagine that. How this world wicked. You say you want to make money, then now you go this company in life. I know if you understand that. Tobacco leaf, and of course, as the person the age. So now I say make we compare. We don't country them, and of course, then country also we do so. You will see 70% na then can die versus the one day we na 30% na yeah. Waiting do because 70% now we don't country them because we late for diagnose them, and of course the treatment we will get is limited. Whereas here now in the country more than half of them go survive as well. So 70, and 35, definitely more than half. The one day we will survive. You see, but then get early screening and get the better outcomes because then get the facilities. We don't get that, but hopefully we will forget them. Okay. Now we don't talk about we country them, but specifically who's how we come out. I say let we just talk about them. So there we go. Salon. Inside 2024, now 1,900, almost 2,000 new cases them nine them fen. Out of them, look, imagine that. From 2,000 you get 1,300. So now over 60% now then go die. And if you look at the statistics we are given now, about 30% of them people in the can be saved if at all we do what we do. But look at them. The one day way with the fen, cervical or cervical cancer, the one where they affect the liver, and of course, the one I've been talk about this prostate, and then of course the breast. You see, so people in the come late in the hospital, the services them not up to the level we been expect them for be, and of course, we not able to follow them up as we need for because of waiting news until we don't get the facilities. Yeah. So, I don't talk about this. When you compare people in the diamond and salon and then they die in the developed world, not to just salon, but any of the low to middle income country them like that, they happen to them. The challenges that we get, think the way they are in a limited screening. I don't know if they get any screening, if you like, programs or projects in a salon. Sometimes people in way know about salon, then go tell people on that. Or maybe we'll get people within the line because I need to see something good for help. The diagnosis, we can make mistake. I know not long ago somebody sent me some documents to them where I look Believe you me, now 4 different people them that they look after this patient. One of them, when they look the ultrasound, they don't do, they say nothing no wrong with the patient. In the same breath, the other one between February and March, now this happens, so why they tell you now? The next one now we say, oh, this person now don't get bad cancer to the point now he don't bulk his liver and this and that. But imagine that from February to March. Hey, how is that possible? You know, that kind of thing I talk. And of course, the person we sick, when they don't tell and say, okay, now that you go on for you. Sadly, if not the wrong diagnosis, well, landing 9 can cause late diagnosis, and of course, misdiagnosis and mismanagement, and then of course the treatment as it were, and they contribute to the poor outcomes where people in the die more now the country than they die now. You see, so as we say, age, as the age they go up, now so the likelihood, the risk they go up, forget the cancer. Yeah, so over 70%, as we don't say already, compared to 30% na the developed countries them. Yeah, they get different one them, either because of the age or because of infection or because of inactivity or limited access to the diagnosis, the treatment center them, or the particular thing that we don't use for treat or for diagnose, like the MRI scan and CT scan. Then they are like nothing else. So man, they say I must, and they know boku. Imagine, then tell me say then get scan na Kono. So you go for travel from Freetown to Kono for go get that scan. They imagine that. You know, I know somebody will obviously being get for do that, which obviously I don't know how with the manage where you're expecting that teaching hospital, then at the capital, but you're not getting at the capital instead, you get for go. I know say then get some Nabatha Street and all that, but then dear. The problem is how much people then go for afford for go pay for that in there. Then you go for pay for treatment, you go for pay for investigation, you go for pay for consultation, you name it. How much people can afford that? So it's not going to surprise you if you really see people die more that we country them than other country them. You see, yeah, poverty and of course, you know, reduced productivity. So, yeah, we'll talk about the doctor side, how for assess the person we come to you and what you go do in terms of diagnosis and then treatment. And of course, when you treat them, how you go talk about the prognosis going forward, how the thing go happen, how you go for day within 5 years, whether you go there alive or not, 5 years survivability, as they say. And of course, first and foremost, preventing it, because some then day we go prevent. But could they prevent, definitely. You know. Oh, some man they say pass you get pain. Well, pain, nothing way some man can live with. But you know me say because you don't get pain, that means you don't get cancer. It doesn't work like that. Now, if you look now you right hand side, you can see which side and put. Somebody will get when your voice caught, a croaky voice. You get them for like a month or two. No go away, don't try for do anything. Definitely you need to get them checked. That not means that you get cancer. Any of them here, if they persist, it no means that you get them. So I just want people to understand, say, oh, where I go, which I don't know, and I know go hurt me. Yeah, it doesn't work like that. Yeah, if it lasts for more than 2 to 3 weeks, 4 weeks, and you say you don't do things for them and you don't work, then definitely you need to go get checked. Possible say you need to get the right treatment. Possible say you need antibiotics where you not been to take. Yeah, so if you dey sweat na net, where the place not warm and all that, or you lose weight, where you need to try for lose weight, or you know they on any aspirin or any kind clopidogrel or blood thinners, warfarin, or you bruise easily. That now another one we go actually make sure say you get for go check yourself out. Yeah, because some cancer then they win and so then they present. I don't talk about pain already. We don't talk about weight loss. If you find lump anywhere in your body, not to pass the bobby or the breast. You can find lump any other side, like now you groin, now you armpit them, yeah, now your neck. All them part then they clearly you get forget and checked out. No questions about that. We talk about the mole, then black spot them. You know, you the kind of person we obviously not for the sun pass mark. Yeah. And of course, pan the breast, if at all the changes happen to the nipple, either it begin bleed or it begin pull bobby or breast milk, where the person not to Kamara or young Kamara, clearly that need to be checked. If it swell or it cause pain or blood come out, or sometimes the nipple don't suck in. Instead of it out, it suck in, or it thick like way orange candy day, or lentin then they point to you, say this is not something for you. Of course, if you find lump, as I say, not to pass by the breast, but anywhere else. And of course, you talk about breast lump, well, the man then your own self, not bad. as I say, it's really important for man themselves to take notice of that. So, your appetite loss, you need to feel for eat. Before you begin eat number, you begin feel bloat, or you begin feel belly hurt, or you will eat much. Until if you begin get good appetite now, the appetite don't go. And of course, if you been to go toilet, go open your bowels, maybe once a day now, you don't change. You therefore go maybe once every 1 week or maybe once every few days. Then where they go, obviously they struggle. Or if you see blood na the pan, or you instead of the size way being good, now you feel like say na rope, yeah, or they like the form of rabbit, then toilet, then definitely the thing and you get for consider for go see and get checked out. Again, if you see blood na the urine, na the piece, then definitely again another problem. If you get problem for past urine, like where they wake up na net 4 10, 5 10, 6 10, clearly important for you to get checked out. As again, it don't mean say because that happened, it means you get cancer. I want people to be clear about that. If sometimes if you do mama and papa business, you do intimate with your partner, you see blood, yeah, where the pan period, or if you don't reach that age where you be saying you're not gonna forget period again, they born again, then after so many years you begin see blood, you begin see your time as they can say where they up na kono and all that, you get for be checked out. All letting them now we will take care of. So how would they diagnose cancer? Well, of course, you don't forget the doctor will go talk to you. You take a very good history, because the history for me is the most important thing, because it could tell you how, when, where, and how long it don't happen and all that, and you get another family or not, you get any other sick or not or whatever. All letting them day. Yeah. Then he go examine you, and if you need for do you go get some blood tests we go do, and if you need for do he go send you for a scan, different scan then day, and of course, if needs be, then don't forget them from the scan, then go definitely send you for what they call a true cut biopsy, where then go pan the thing, where then see pan the scan and get the sample, send and go to the lab where you can't mistake them. You could definitely know then what happened. Having said that, sometimes then the scan, the biopsy self, the scan self, sometimes nobody for pick them up because it's too small or whatever. And sometimes then they then get for keep an eye on them. Plus, of course, the biopsy sometimes then they go, they not get the exact part where the thing they miss them. So it can give you that false reassurance, say everything okay, when in actual fact, no, okay. So that's the kind of thing we'll be mindful of. Yeah. People in Kifil say when they do the test, them can cause cancer. Doesn't work like that. Nothing. If anything, then go help you for detect this thing early enough for make them able for investigate and give you the treatment where go save your life. There's no questions about that, because they increase your chances. If you watch, you go see. When they screen people them by the GP, you go see. Yeah, early enough, you look at 34%, late in that 22%. And if they do routinely, it's like the urgent one. Then do it routinely, where then just they go like every year or 2 year or whatever, you go see. You see, early, then they detect them definitely. Whereas late, and that they tell you from the number of people in with it, you will see that. And then of course in an emergency, so it goes down. The thing they reduce as per the channel where they use for DUAM. If now urgent GP appointment, you get in your own, not as good as the one we're in a routine one. We can get then to offend them accidentally, as they can say, or incidental finding. They look for something else, then go find it. Like this man, they tell you so in pain na in right hand there, but then go find this thing at the left hand. Where then find the stone at the left hand, at the left kidney. Yeah? And this man now they worry in head. And the worst thing than cancer itself, now health anxieties. This man they don't decrease. They think about all kinds of things beforehand. And in actual fact, when we go look at the scan now, the scan just say the man no get no cancer, which he get like this stone within at the left hand, but the symptoms and then at the right. And for that, we refer them to the urology for let them go see what they can do. So it just goes to show you that the sooner they see them, the sooner they're able to find them, it go better for you. But of course, if you wait till an emergency happen, well, there you go. You go see it go down from 34 to 25 to 21. And then, of course, in the outpatient, you get 11 to 3%. You see, it's not just the people in way they deal with cancer that put this thing up. So the late stage, now we want to avoid. Yeah. So So the cancer, as I said, we don't tell them sometimes they can right, sometimes they can wrong. But obviously, they pray God let it be wrong. However, even if a wrong, I don't think say he harm you in any way, because at least he don't tell you say you don't get her. He don't prove to you say no, you don't get her, which is good. So now I see somebody go sue my colleague because he tell and say he get cancer, and then in 3 months he blow all in life savings. Then when they can find out say the man don't get the cancer now, then tell her he live for another 10, 15 years. And if you kill not to the cancer, you go sue my colleague because he say psychological torment, and then you don't impoverish him, you don't make him poor. You know, when some man go think he say, this man give me wrong diagnosis. He better he give me wrong diagnosis, but at least, you know, I don't get him. Some man they think differently, but he sued the man, and it was not a good thing. Now make you afraid for tell person say he get him when you're not too sure say you get him. Yeah, as it is, we get different things them for do for the cancer. We get operation them, we get X-ray treatment, we get the treatment we give by tablet or by injection we can give, and then of course we get the one where they do when targeted therapies. And now the particular areas outside the cancer day or the growth day, now they then they target for let them reduce that in the. Plus of course immunotherapy. People who get they self king prone to cancer. The people who get transplant organs, kidney, liver, and get for take then tablet way for help them for let the body not reject the organ with them transplant. And in so doing, they can end up get cancer as well. Yeah. But of course, every year they make advances, they make improvement, they make development for see how we go for men, then people here with cancer. If you watch, you will see this now England 2013, but obviously done better now. By then, if you see the early versus the late, the early one stage 1 and stage 2, late one stage 3 and stage 4. This now all the cancer them. And if you watch, just about middle, 54 and 46%. If you look at the breast, you will see the early one, 54%. So if you go in time and then pull the lump, then pull the lymph node them, if then they armpit, then you likely forget a chance far better. And if you come late, we're now only 16%. If you look at the gut them, you will see because some man they come, some man they take as in a normal thing for they get constipated and all that, see blood. But again, the blood by the time you see them, it means the thing don't grow to the point now it invade the lining, the gut, when they make it bleed, or the polyp they get damaged by the motion them, and so therefore they bleed. So that make you see 45, 55%. The lung, clearly, if you see, because people then just they continue for smoke and this and all that, most of the time then they come when all thing don't really unbug. 77%, 99% then they come for letting can diagnose them. By then the thing don't spread now, go to the blood, go to the bone, sometimes then they go to the brain, and then you get this one with the skin. Again, if you come early and then see that black spot there, aim for treat them, guarantee you get 91% for let them see them, and of course for let you survive. Ovarian, again, that the human own them. Again, it's bad, it's difficult for diagnose. If you're able to see the symptoms, then sometimes you bloated, sometimes the period them irregular, you bleed more than you should, the belly begins swell and all that thing, or lose weight, then definitely important for make can check you. If they check you early enough, they can get about 43%. This lymphoma what they talk about. Yeah. And the one we get them swelling at the neck, at the groin, definitely they can late for diagnose that and because attending day now inside the chest now. Oh. We don't talk about this already. The option that we'll get. We get surgery, operation, chemotherapy, either by tablet or injection, or we get the X-ray treatment, or the newer medication, them target therapies and things like that. They can do that. Even when we know say this one we no go for cure incurable, but we can suggest palliative care. For example, somebody get prostate cancer where don't spread. We know say we no go for menam. Then get in there, then they do. Then they give injection them. Then they are like which, yeah. They give injection them, and then injection and then they help the person for go forward. And sometimes there's a man can they live for another 5, 10, 15, 20 years after that. Yeah. Wait some time if I don't die, if you don't not been there. But then I want to know for look at this. Look at this. I think when I've been saying that the gut, it's not the skin you see. It's not where you don't get nothing. It's just there. Yeah. So if they cut that one, they come out, likelihood say you could completely cure. Yeah. By the time you get to this bit, see inside there underneath, they're under the skin. Until you begin push up now, then you go begin to say, begin going to the lymph node. And so then get for them think about waiting for do. So then get for give 2 centimeters wide out of the area outside there. Stage 2 now is spread locally, as it were. And then stage 3, obviously, they go inside the area then because of the lymph nodes here. Yeah. By the way, the crab they talk about, what they make when they see the thing, the Egyptian then call them the cancer, the crab. Now because when they look at them, if you like way they leg them of the crab, and then the blood vessel and way the thing they affect, where they attack. Now then get that in there. And of course, when it's spread, it's not the thing there. And the bone, now the liver, the lung, now the spine, of course, not the blood. So then get this classification, then get TNM. Again, depending on the size. The size of them, T can go from 0 to 1 to 2, and then the lymph nodes, one within the area outside there, or then the one within far away. And then, of course, metastasis, now where you come out from one area to the other, either through the blood or through the lymph, when the military, the defense of the body, or through the fact that they invade them like how you see how they do now. So inside the same place where they invade lower and upper. Yeah. So important for me when see this slide for me to know. So when cancer at the beginning, they begin quiet one. As I can say, the silent ones, the quiet ones, the dangerous one them. Yeah. You get the risk factor them. So if you watch this, a very good slide. You know, if you look at this, the symptoms them at this particular beginning of the journey, you see saying that the GP them, most of them, and then can get for do that in there. So the GP and the nurse within the practice, then can look at the symptoms, they identify them, and then refer to the doctor them at the hospital them. So this is now primary care, and this is now secondary care. In the secondary care, you get the different treatment choices that we don't talk about already. So amongst the doctor them or the personnel, the one day you go see, you get the one day they do the X-ray or the MRI scan or CT scan. You get the pathologist, the one day they deal with this sick, and then can actually diagnose, and then go biopsy, or then pull the sick itself, then go in the column, go see another lab. Or the oncologist way in and work for determine the treatment, and of course the nurses then with the power all the while, then self can win and that they can take part. Then of course, once they don't diagnose and the treatment, then you get for think about the different things they need to do. The cycle then within the give some man 1, 2, 3, 16, 20, 24, and all that. Again, and then why they get involved? The oncologist, when the person win a specialist on cancer, and then of course the one win a surgeon win and get for operate for pull. If not the gut, or not the skin, or not the eye, or not the brain, any of those, not the surgeon. And then of course now get when they don't do all this, then don't pull the sick, then don't do the therapy, then they end up now the one the way live with the hopes that then go be in a majority, and the other way the sick don't continue now to the point where in a palliation no more now. Yeah, or even the palliation, you can still do things we go help the person. And then you go see Macmillan nurses them and the oncologist and then the other nurses them. So that's so that the journey this way they get. Yeah, we get people that we don't live, we don't survive cancer, we definitely don't come and tell me about them. Yeah. All they talk and say, the sooner you go seek help. No go begin pass Ben Pabu, take and say now which, go begin get them boomer. Then lift them, check out today, this time, blah blah blah. Expecting say na malaria. No. You need to be checked by the appropriate people. Not when you wait till what pass Gary, you expect say magic for happen. Doesn't work like that. Because the earlier you get them, the more likely you go for survive. Yeah, we need for encourage people for come forward, for seek help early. We need for stop the stigma, for begin point finger upon people and say, oh look come on, and because you know they pray to God, and because they witch, and no, they swear and all that, which been do. No, it happened to everybody. So let me stop the stigmatization and help people them. Yeah. So if you look at it again, we don't talk about it. You see people they die more in a salon than in the outside world. If you watch, this is not the world, 65% for the cervical cancer, to win on 30%, so half. You look at the breast, you get 75% at the outside world, and to win at 25%. Again, issues than that. Well, of course, prostate cancer, even doing no allow it would have been a lot better, a lot more than that, maybe in 1995, if I told them allow it for do that test they would talk about. As you can see, in my own country, them as alone, they go. Liver, 10%. Liver is around 20%. You know, so it just goes to show you. Yeah. So of course we don't talk about the diagnosis, the treatment. Now we go for talk about how they prevent them. Well, as you can see, 4 out of 10 we can prevent them by changing our lifestyle. Yeah, by keeping a healthy weight, because on some cancer then they're more likely for happen when person we get don't put on weight, you know, person we obese, as they say. Yeah, we try for cut down on the smoking, and if we're able for quit them, not on the alcohol, because alcohol they make you put on weight as you work, because there's so calories, and that can cause you more prone. Forget that. Yeah, imagine that. Yeah, you get for definitely remember, say you get for block the skin, where they go find that vitamin D for top up. Because otherwise, if you get that melanoma or you get that nevus, that black spot, you can probably trigger them because now ultraviolet rays in the sun. Yeah, eat more of the plant protein, reduce the amount of meat. I don't say not eat them all because you need them for your iron and all that, for your protein and all that, but less of it than more. Yeah, high fiber diet, we need that. I hope we got them. Be active, it's important, and of course, this salt, not the help with. Yeah, other things that we can do. Obviously, we breastfeed, as I say. Of course, we minimize radiation, and of course, if we get the infection and we do like Gentri, we call that human papilloma virus, when they cause the cervical cancer. If we hope for treat them, or hepatitis B, if we hope for treat them in time, then sometimes we can prevent the increase of the cervical cancer and the cancer of the liver. Yeah, and of course, if we screen early and get the vaccine, well, definitely we go for help. Yeah. So as a community, what we go for do? We screen for we urge people and we coax people and we encourage them for let them go get screened for then see whether they get them, and if they get them, then catch them early, then go survive better. Yeah. We need for talk about this thing. We need agree for talk about them because that big C, that big C. No, it can happen to anybody. Therefore, we need for talk about them. And the more we talk about them, the more we're likely for do something about them sooner. We need for be aware, and at this now they do so now for teach people about this thing, for tell them how it is, waiting for do, and keep an eye on things, and make sure that we do what we necessary for do. If we live a lifestyle in a way we're definitely healthy, we will definitely reduce that, and we need for take action now. Not to tomorrow, not to next tomorrow, not to next year. Now, encourage family members for come, and of course, we in the community we get for come for push for the entire for happen. So, don't talk Boku, but this is important. If you watch Naya, cancer no mean say you they die. Please look at that. 95 to 95% and 99% of people with regular testicular that bolocos in cancer then can survive. The prostate, as I say, if you catch them very early, it's likely for let you survive 100%. Thyroid, that get in a throat now, again, up to 100% if you get that. The one at the skin, 99% if you catch them early. As you see, the breast cancer, well, we now begin thinking that mopia. As I say to you, man, that mopia, not only way they breastfeed, that breast abscess, we don't call mopia, and way they breastfeed. Not to way you know they breastfeed. So if you not get baby way they breastfeed, yet you get this long with the pull blood or whatever, please, let nobody not come fully tell listen I'm up here. It's not. Lymphoma, definitely, 100%. Then don't find things the way they help. A lot of people didn't survive. And of course, the cancer way they happen by the picking them, most of them, they catch them early and then they can survive. Definitely. So now the word that I tell you, I thank you, and I go stop now.
Thank you so much, Dr. Kamara. That they will know me. They know I make her laugh. The last slide.
the last slide.
It's all right. I'm not going to repeat them.
Okay.
We move on. But thank you so much. For an overview, I feel you touch a lot because we don't do cancer awareness before. But this one go a little further. For una we na medics, I'm sure una go appreciate the kind of work we Dr. Kamara don't do. Like what I can say before they can present, me and post we are curious. Anything we then put up a topic, I can always go try and find out. Do a little bit of research for no. When I find out the amount over 200, I'm like, what? Don't get me wrong, I'm not trying to read every single one of them, but just standing on a low amount of numbers, they give you perspective on how serious the issue be. And for we young people at home, now whether screening they happen regularly and stuff like that, that's a conversation for another day. But we the Ubadensaya, we get the opportunity. Normally they can say we black man, I think now the age 30, I think, or 35, I can't remember again, when we need for the go do various medical checkups, for make sure we catch any of the sickness there. Don't get me wrong, yes, think you say black don't crack. Yes, most of we look younger than we age. But I don't mean say from a medical standpoint, all is well. Because some of the things that they will be will be younger, 15, 16. If you try to do anything, then now trust me. Mona me we will be the Ben and team up and do all kinds of things. So then I can Ben, I can hear some crack. I can be like, whoa, man on the carriage. But thank you so much. Now me family, I've been promising at the end, everybody will get an opportunity for they ask any question. We ask any question. I'm not missing every question or no. Hold on, Uncle Doc, big. Is that complete back one more time? If I'm like, so what? The man get level. He don't come get boss me. See me na sasma over now they drink. Yeah, so all jokes aside, now I have opportunity for ask questions. I will look on the chat and see if anybody don't get any question. So Monday, I know somebody can send that to me personally, which I try not to. I need to try for encouragement because we do a while when I ask them on the forum, yeah, we everybody else go benefit. Yes, Auntie Nafi.
Good evening, everybody. Thank you so much, Dr. Kamara. Great presentation and good refresher for me. I get a question. So, there are phantom lactation. Again, anything for do with breast cancer. Somebody been talk to me about phantom lactation recently. I know everybody, but I've been knowing that phantom thing and like phantom pain. But then the person they tell me say when you don't go read about her and then tell her say, it can get for those premenopause or menopause. But I just want to ask if you get anything for those breast cancer. They feel like for say you breast they produce milk, they feel like say milk they come out of the breast, but they actually see them. This feeling of say when you look, they see all side dry, so where they feel like for say the breast, now the phantom lactation. I don't know if you get anything for those breast cancer.
I mean, I know, not as far as I know, but then I'm not too sure whether any of the breast specialists them go tell you that. But as far as I know, I don't think say it linked to them. Because we can do if you say phantom pain again, the word phantom na the person in the film, so not like a mental health problem. You see, as I can say, it not mean say because we not get knowledge of waiting they happen, it means it's not possible. Which I know is that then call them phantom letdown or phantom milk ejection. This they say directly related to the breast. Outside the person don't stop for breastfeed or ever breastfeed, and then they experience sensation them identical to when you witness. So they don't get no connection with me see as far as I know we get for do with breast problem. However, the need for distinguish between that phantom lactation and galactorrhea. Now, galactorrhea is actually a pathological leakage of milk when the person not get belly or need a breastfeed. So now the difference between this and waiting at the table, so this galactorrhea in real, phantom not just a sensation. You know what I mean? I don't know if you get me.
Yes,
the sensation not necessarily means that you get a breast cancer, but if you're worried, I keep saying, if you're concerned, say, I get this kind of thing, will clearly get for be assessed. And I guarantee you, as long as you mention something about fears or concerns about breast cancer, then go see you within 2 weeks. And they go do a mammogram, and if needs be, then go do a scan if they need to do, and then take it from there. But as far as I know, that lactation day, when a phantom, no linked directly to breast cancer.
Okay. Thank you.
Thank you.
Okay. Thank you very much. I get a question. One question from Abu, S25 Ultra. I say, what's the stomach of prostate? I don't understand. What's the stomach of prostate cancer? What's the name? Is it the root cause?
So they ask all two.
All two?
Yeah, the stomach cancer and prostate cancer.
Prostate cancer? Okay. Or maybe
I don't know.
Maybe they don't
or
understand.
The difference? I don't know.
I don't know the difference or the root cause or...
The person there on the call, he can actually update in question.
Abu Ultra S.
Yeah, there is the hand. Okay.
Go ahead, sir.
Yeah, sorry. Now both have the one asked for, sir.
Okay.
So waiting, especially you want to know about both or each one?
With regards to the prostate, waiting could be the cause, the symptoms, and the other one as well.
And the stomach cancer.
Yeah.
Well, stomach cancer, it's an interesting question that because some attendant, you need to get any specific symptoms, but something like bloatedness, easy feel. For example, they feel full. Sometimes you just take 1-2 spoons and that. We know to that being the happen. Or you begin get that feeling for vomit, or you lose weight, or you don't know. And then, of course, you can get belly out. But that then late sign them, as it were. Yeah? And then, of course, you can vomit, because what you do if not the bottom bit inside they empty into the small bowel, then this can cause the belly for swell. Then it make you bloated, and you begin get a lot of gas. And of course, you can actually feel for vomit, and sometimes then you can vomit. But more importantly, if you feel lengthened than the weight loss without necessarily intending to do so or intentionally doing anything for lose the weight, then clearly you need to be assessed. Yeah, within the cause and well, the multifactorial issue, then people in the way particularly prone to them, the people in the way get the problem with the H. pylori, then get that bug there, where they did at the bottom of the belly, the stomach, where it can cause that. Another thing is just the fact that the cells then at the stomach, they, if you like, overgrow. Nothing in for stop them. That can happen. There's a lot of issues which can cause nothing for end up like that. But the symptoms then vague. But clearly, if you lost weight, they lost weight, you feel full when eat, be possible to get good appetite now. You don't get that much. You find that then you feel bloated, feel pain, and all that. Then perhaps you need to be checked. Now, it's possible to say not just gastritis you get, not just an ulcer you get, but the sooner they check them, the better. It's possible to say they come up from the food pipe, the gullet. Now they give you that kind of feeling there. Like say you feel so you don't fill up too quickly. Yeah, you can become anemic. You can probably vomit blood. All the different things, and they can actually make you begin thinking, go get checked out. Yeah. The other thing for the prostate, well, of course, prostate, the same symptoms where you get, we don't talk about this before. I think that Dr. Tuli been presenter. The same symptoms where you get, or somebody will get an enlarged prostate. By the way, the prostate, they grow throughout the man in life. Okay. Sometimes they can grow in or it can grow down. All right. And if that happens, obviously, as you get older, which is normal, by the time you reach then 60s or something, you probably go get then symptoms in the way you flow. Like when you go to map day, you get for weight for a long time, for lady we come out. You feel say you want to go, we go, it take a long time for come out. Yeah. Then of course you get for begin push. You find out that you begin push, begin bear down, and then of course you begin dribble. So if first time the team they go all over the place, now they go on the WC in cover. Yeah. And then of course you feel say you don't empty the bladder, but then you wake up 5-6 times na net. For let you go empty your bladder. And when you go, sometimes a small number go come out. And of course, worse still, if when you want to go, you don't go at all. We then call retention. Then they on an emergency. Okay. So Again, prostatitis, inflammation of the prostate, can give you that. And that can happen because of some bugsdem, and that can happen because of the urine within the bladder. It don't become very acidic, and then it make you more prone. So there's a lot of things we can cause that. But again, if the immune system is strong enough, you can fight that. But if you feel, say, this thing that they feel pain, and they see blood, where they go with, and they go more often, and where they go, and then they able for a go like cabin they go. I get for wait for a long time. And more importantly, back pain. So if you get back pain, that is not a good sign, especially if not net. Now they get the back pain. And when you lay down, the back pain forget better. But if you lay down now, the back pain don't get better. That is not a good sign for person way day in their age than they bracket day, and you can for get checked. Definitely. I hope so that they're okay.
Okay. Thank you very much, Dr. Kamara. Another kind of a question again on the chat. But one question I want to ask before I forget is that you mentioned about some treatment will cost a lot. And if we now also it cost a lot for we, how somebody be able to afford that day back home? Or is there a way around it when it comes to people that we get that kind or we need that kind of treatment there locally? I know, yes, your information from back home kind of limited because I'm obviously part of the team, but I just think about if you did look from we on standard now, so it's very expensive. What's not your advice for young people in back home?
Well, I mean, it's a bit like you asking me about America and the UK. Yeah, in America, I don't see them go remove the prostate. Yeah, $22,000. Now cost. But we, thankfully, in the UK, we NHS free for access any part of the country. That's one good thing we got up with in the UK. And if you then try for marry that to the country, then, as I say, obviously, if you're not able to afford for let them investigate you, it means you go struggle. So a way out for me is probably then can probably change the way then they do things in a salon in terms of subsidizing the healthcare centers, the hospital, from the government. Because if the government do that, then obviously you get the one way at least then go for see way and they don't get for pay, they don't get for do this. But of course, that would mean a lot in terms of sacrifice. Now, the GDP where salon get towards health, I don't know. But I know full well that it's important for make the government able for subsidize one way or the other for help the one day we're not able to afford that. Like Rwanda, that model they work. It work for the woman them, especially the hand they expected mothers. The hand we get belly, the hand we conceive, then get that, then get free treatment. Right through to the very end. You see what I mean? So that's one way. So if they're for subsidized, but now the way salon they conduct in health system or the way they make them, the format them, they're paid system. Okay. So if they maybe for create like an insurance facility, or maybe a project or process policy where you will get insurance, health insurance, then perhaps that go help. Because if you're able to afford for pay on a monthly basis, even if now 1,000 leons or something or whatever, if you able to afford that, by the time the time come, you go then able for claim and get the treatment done or the investigation done. That might be something we'll go help people up. But if the truth be said, if you don't get that money there, when clearly there's not much you can do. You just asan and think, say, God go help way. But clearly this is something that needs to be handled by the government in terms of whose model we don't work in the neighboring countries, that the region, outside of the region, that the, definitely, if at all, they for do that, for me, that's a plus. And that go up. We go do what we for do, but in terms of financing it or funding it, I don't think they will go for do. I'm sorry. But it has to change. It has to come from the government.
It does make sense. You touched on two areas there. Danisha, I see you, Anop, and Ashraf, I saw your question as well. I'll get onto those ones in a bit. What I want to say is, you touch on two areas then. One for me, I would say, before even we get to that stage, we will think about for pay, like we Dr. Kamara been saying previously. Let we look at the preventative methods, as in let we change the lifestyle before we even get to that stage there, because we might get to that stage then we not get option, as in maybe we'll not get the money for we can't afford it. Another thing is I think we mindset as well as a nation need for change. Because if we all know, we all say it's not up the two. This is not about a particular government or anything like that. So please, for that we go look at say, oh, maybe they're against this government or they're in favor of, I'm not in favor or against any government. But I'm looking at it from we own mindset as a citizen. If they say for let we pay money to insurance, as things are at the moment, when it comes to car insurance, for example, people pay car insurance for the name of it. How many people claim car insurance in Australia? When they get accidents, man, they can't what pity, all man, then she cannot go away. The only time we maybe they go swap details now if they damage Boku, then whosoever the driver behind they resolve the issue. Unless you work for a big corporation, now then they looking at insurance and stuff like that if you motor car damage. So when it comes to national insurance for health, I don't know exactly how it will work, but we mentality as a country, as a nation, get for change that if they bring a health insurance, people are paying to that, I think it would be best that money they get utilized for the purpose we people really get for, because people sooner or later go look and say, I they go pay me money, I don't go ever able to withdraw that money because they fear say because of lessons we don't learn in the past. And say they go pay money and never ever see the benefit of them. So that's something for the one day where they listen, we get the opportunity for implementing things in there. Or tomorrow, if any of you in our position there for implementing, they are the big. Let we do and do in the name of the people and law. Make sure say we put governance processes in place for make sure say actually work for the benefit we designed for. Dr. Kamara, I get a question from Ashraf. He say this is about his son. Given that some of we, like a miso, for example, are black. So I don't know how much damage sun will do to me, but obviously there's precaution. Now, what you got advice when it comes to vitamin D? You say, can you touch base about the vitamin D you briefly mentioned towards cancer, and especially for real people in back home, given that the sun boku back home? What's your advice?
Well, I mean, when I go to Rwanda, I always pick sense from that. The marginalized groups, then, for example, the Rwanda like that Jews, the albino.
Yeah.
Then get a group, because the albino, as you see, they don't get that melanin we get. Because the more the melanin, the likelihood to the person darker than the other person. Okay. So as things stand, they don't get that at all. Because of that, they're prone to skin cancer. So what did they do? Again, they hide them because they see something. So they are working hide them. What did they do? They provide protective shades for them, and then they provide hats for them. Then, of course, they increase the awareness and sensitization. Yeah, so that we could take care of ourselves. And this is it, like how you put a number. Salomon, if you can't, you say you don't pay to this insurance until 4 years, claim. It's exactly for nothing. And unfortunately, God forbid, sometimes that month where now you not pay, 9 things happen. And that's how it normally happens, as I say. So now the problem that, so therefore, it's a sacrifice worth, making. But, as I say, if you they walk outside in the sun, like where they walk in them farm them, you can forget protection. You see, you can forget protection. And you can forget the time limit where you they go in the sun. So if you they go, for example, go sunbathe, so then 10 minutes, 15 minutes, maximum 20 minutes, but get a sunblock. So if we encourage people to put sunblock on, it reduces the possibility of skin cancer. That's for sure. If you say you get them boku, nivus or nivi, then black mark, then clearly you need limited time wait for no say me say for take responsibility for my own body. Therefore, I cover my head. Therefore, I cover my eye. If I get for day out, I put sunblock. Therefore, if I get for go walk, I go get for definitely arrange with whoever I deal with. For example, the manager for making For example, somebody will get high risk pregnancy. When they come to be in A&E, we do risk assessment, and that's where we're lacking. There's no governance. That's what we need. And that governance we need for able for march forward. Yeah, when you don't sign that pact, they may employ you. I don't sign that contract. They say, yeah, I need for look after this, this, and this. You as an employer, and this, and this, and this, you get for do for me. Then we know what you get for do. If you breach that, I go sue you as it were. If me breach that, then me go suffer. But with that, you go forge ahead, and that's what they did in Rwanda. Now make it see in the progresso. And I think say that model they go wokeness alone if only we get that discipline for implementing.
Thank you very much, sir. I'll go. One question I want to ask though, keep that in mind, maybe we'll answer that later, is there any remedy where you go suggest as a sunblock, given that now yeah, we get sunblock and stuff, is there any local remedy we can use? But we'll come to that day. Claims, what's Netta? I'll look for you, yeah? La able ask you for, yeah, there you are. Can you unmute, please? Danisha, please, I'll come to you. It's just that this person be done ahead of you. Yes, Clem.
Yes, I don't know if you hear me now.
Yes, I hear you.
Yeah.
Okay. I really want to commend the speaker for whatever, but a couple of other things that I noticed that you didn't touch on, and that is leukemias. Leukemias are very important cancer, especially in childhood leukemias and also neoplasms as well. The question I get is like, I mean, get experience with somebody treatment at salon, we get a cancer. We cannot tell whether it was ovarian or whether it was it was from the uterus. So is there a way in which you can distinguish the two? And I would really like to make you just interject leukemias, because leukemias can be easily treated, especially when they're in kids, because sometimes you only begin 3, 4, 5, 6 months, the beginners die. A lot of people don't know why the beginners die. So exhibit leukemia, which can have very simple treatment. The one little concern I have is your elevated PSA result. I'm thinking if you have an elevated PSA result, there is a very good chance that you must do something about it immediately, because there's a good chance it can be leading to cancer. I know say you talk say not necessarily be cancer, which is true, but in most cases, once you get your PSA elevated, it's probably going to lead to cancer, and you don't want to wait, because as you probably know, most of those cancers easily they spread. And when you don't spread, na different thing now where they talk. So
Thank you so much for your
Yes, sir.
concern, and thank you for sharing the experience with me. Now, I don't know if you see, unfortunately, I don't know, the title itself now, an overview. And I think that the moderator in comment after I'm done, he say for an overview, you don't touch on a lot of things. Now, if I say I touch on the more than 200 types of cancer, we're not good on today. That's for sure. And especially with the picking them, you know, leukemia is obviously, yeah, we can talk on that. I mean, maybe don't talk on leukemia in the emergency department, because me not A&E person, me not emergency department consultant. I don't talk on that. How then they can to we, what you can do. Because most of the time, now we can actually incidentally find them out. So man can just say, I don't feel well. I feel like, say, my body weak, my bone in the heart, you know, I just feel like, you know, headache and things, and that's it. And then when we go do the bloods, like that, we find out, say, the white cells in their 20s, high 20s and 30s and all that. Then we for contact the hematologist, when at the blood specialist. And then, of course, they'll take them from there, begin to do all the investigations when necessary for established diagnosis and the scans, and then sometimes the biopsies and all that. And then, of course, begin the treatment. We can talk on that specifically. So this is just an overview on awareness for cancer. But if you want, for let we talk on childhood leukemias, we can do that. We take that on board and we can put it. Now, that kind of thing that we want. We want for let choose topic for we want to say a topical one, and then we can actually act on that. The other thing you talk about the PSA. Now, obviously, as I say, if the person where they do this test, not don't ask you whether you don't intimate in the last 24, 48 hours, and then you get to raise PSA, you get for definitely take that with a pinch of salt. As I say, the difficulty with this is that we get what we call spin and snout. Now, spin specificity. So spin means you they rule them in, and then snout yeah, the sensitivity, you rule them out. So PSA, very sensitive. For example, somebody who don't do a gym for an hour or two before you go do the test the next day, they go day up. Okay, so man way then don't do a rectal exam, they will put the finger at the back passage, he go day up. Somebody way don't be intimate 2 nights or so before, he go day up. Okay, somebody way even get prostate inflammation, prostatitis, he go day up. So different things that can make it day up. I make the government reluctant for then take this thing as a screening tool. Because what you do, it can go up, but then not necessarily means say you get the sick. And likewise, it can negative, but that not mean say you don't get the sick. So therefore, if we get a slightly raised PSA, and we can't tell the person you get the sick or not get them, then clearly we need for then advance. And anytime we do a scan, whether negative or positive, which can be the case, sometimes it can be, poor value for money. And that is why the government still struggle with that. If you get a slightly raised one and the symptoms, then or even if you not get a slightly raised one, but you get the symptoms, then you definitely go require further assessment. I don't know if I did make myself clear. Because as I say, it can go up because of different reasons, and it can go down because test positive, but then you get the sick. Therefore, you need for go by your clinical symptoms. I always tell my colleagues then that treat your patient and not the blood results. And that applies to this case. If your PSA is slightly raised, that not means that you get cancer. Again, if you get a lump in your breast, that not means that you get breast cancer. There are other things you can do that would actually suggest and confirm whether that's the case or not. And then they say ignore them all. I want you to be clear. Don't ignore it, but then that not means that's it, the death sentence or whatever, you get them. No. And if you talk about it spreading, well, I don't think say within the 2 weeks of knowing that, it will spread beyond, what you call them, a cure. It's not, because for we in a 2 weeks referral pathway now we get. Once we suspect this, 2 weeks now they refer them, and then obviously it gets in, and then further assessment and take it from there. So I hope that's helpful.
Clem, I'll ask you for unmute if you want again follow-on question.
Yeah, it is helpful, but my one concern is, if like you said, if you get an elevated PSA, don't ignore it.
Yeah.
Unfortunately for the PSA, you probably not go see no symptoms or no feeling until you go for your annual exam or whatever. Then they do a test and say, okay, your PSA high. So mostly by that time, sometimes other things you have to do scan, as you say, or whatever. And if they say, okay, if you don't swell, you don't big, okay, the doctor can pull them. Then you get to go subsequently doing other PSA tests to make sure say that way you go take for no say either I don't spread or not, because if you still getting elevated PSA, if after they don't remove the prostate, then that one of the way you can actually know say this thing I don't spread though. So
yeah, but what you tell me now the specialist in your own trajectory, as I've been put on that slide, you get the journey at the very beginning when the GP and the other nurses in the practice. That's not primary. By secondary care, now you go to the urologist, not only a urologist, but you go an onco-urologist. So oncologists, where they deal with urology problems. Now and then go carry on with that. So the follow-up after that, obviously, the PSA monitoring and all and the rest of it, clearly, they get for a day. And then, of course, not only that, they can get the PET scan. So the PSA would be there, but the PET scan is vital for see exactly how things are. And then if you marry that with the PSA, we count down to less than 1, depending on the age and all that, it's fine. But for me, importantly, in the ED or the person himself, they have to be armed with the knowledge of waiting the symptoms, the awareness. This, if you by the age of 40, now they know they happen, but now at the age of 50, it happen, and of course you get another family, clearly you're at a higher risk. Like I've been telling you, somebody will get breast cancer in the family, yeah, and then don't check them, then find out that they get BRCA gene 1 and 2 positive, clearly they need for act. But in the case of the PSA, it's not definitive. This is what I'm trying to tell you. When it goes to monitoring afterwards, now they're not a specialist. And me not get, they within me remit for tell you which thing go happen, when it not happen. Because now then they do that. But me go just tell you, say, at the initial stage, if you get a PSA that is raised, it not means that you get cancer.
Okay. Thank you very much, Dr. Kamara. Because of the limited time we'll get, I hope Clem, at some point you will get in touch with me, for all carry that conversation. Oh my God. Denisha, has she gone off?
No, I'm not going off it. Yeah.
Yes.
Yes. Firstly, I want to say thanks to Dr. Kamara. It's well presented for the cancer. And Dr. Kamara, personally, I see you last week, but you might not see me. The Piltons.
Right.
Yes.
Right.
Yes. Dr. Kamara, get into the for like what you said about for longer medication, which can lead to cancer.
Yeah.
The firstly is that this is a personal thing. My husband passed 3 years ago due to lung cancer, but
dear.
he never smoke, he never drink. But
Yeah.
the initial thing was he had a kidney transplant long time ago.
Yeah.
So he lived with kidney transplants for many, many years.
Yeah.
But as the early stage of the lung cancer, which he never knew he had lung cancer, is it went for like St. Thomas's and Guy's Hospital. Then they do a research about why Black people they get kidney failure.
Right.
So they use them like a guinea pig. So
Right.
it went for this thing. So then check during the time when they do the check, then find out saying potassium went so high. So then check. Then they find out, say, it has this early stage of lung cancer.
Mm-hmm.
Doing the research when they do for help, for Black people as well.
Yeah.
So as the other guy they talk about finance, when they want for do the initial treatment for the lung cancer, it has to pay so much money because it didn't meet the criteria for NHS at the time.
Yeah.
For make them go get free treatment.
Right.
So at the time, with the family gathered together, we pay the money, but it has to go through another long process to fill the form for make it will get like a grant, then go help them out and things like that, because we they compare here in Sierra Leone. So these are the things, whether it's NHS, but you still have to pay at the initial stage until then see you the way you your application before then go say okay, yes, they can give you the grants, the fully you have to pay fully or less. So initially we pay for 3 months, and then it was able to get the full grant so that he didn't pay for the next treatment because it was injection, very expensive. When I said expensive, it's real expensive. And when you look at it, you either pay, it's your life than death. Which one you think about? If you can afford it, you have to pay for it. So pay for it at the initial stage. So, but he lived after that because they found it initially. Because if he didn't go for that kidney thing, he would never knew that he have lung cancer.
Yeah.
Because it was small tubes, very small tubes.
Yeah.
Very, very small tube at this initial stage. Because even the oncologist said you can live for 10 years, you don't even know until you just collapse one day and then you die.
Yeah.
Because because it is internally, you don't know until, So, but they help him out. So he lived for long before he finally passed now 3 years ago. Because when you have lung cancer, they'll give you a time that between 5 and 10 years. They will give you like that time space because they will. He used to say to me, Denisha, it's just the lung cancer also thing like where you go say you go to remission, like where you have breast and everything. It's just that they will manage you, keep you alive, keep you going until God take you. So 3 years ago, God take him. But I'm so happy what you explained. It's not that he drink, he not smoke, he not drink. It's just the medication, the anti-rejection tablet of the kidney that caused the lung cancer. So thank you for that. Thank you.
My pleasure, my dear. Thank you so much.
Thank you so much, Denisha. And our condolences. Sorry for your loss.
That's okay. Thanks.
Sorry, but thank you for Dr. Kamara.
Yeah, thank you so much. Yeah, good road. It's unfortunate these things happen. But I mean, if not the experimental drug, then DEPA and all that, normally it depends on whether or not the NHS 9 they undertake the experiment day, or if you like experimental drug or research. and then, you know, obviously take it from there. Now, I don't know why they for charge you. Normally, that not to that in the case. They can actually say, in fact, then they actually supposed to be grateful to you because you actually agree for be part of the team where they do the research in terms of the way they do then get possibly they get the drug within they try for investigate or maybe research, and then get that group there of the people who go receive that drug there, and then you get the group where the people who go not go receive that drug there on like a placebo where they say something. And I don't know if you remember where we've been small, then nurse them or then doctor then can kind of host then give them a then their pump water injection, you know, because the people then believe say if they don't put injection and then waste, that the doctor no good. But of course, when the doctor they put this water, when they put this injection now water pump water, now they put, and you know, ironically or psychologically or whatever, then people they go wee all night long, and then in the morning they feel better. Whether they call them, you know, a placebo effect or nocebo effect, then get, I don't know, but it work, you know. So I don't think say they're supposed to actually charge you, no less the drug not available at the NHS. Yeah. So for example, for let you able for fulfill the criteria for let they actually fund them, I think you get forget certain boxes then ticked. Now, if at all you don't tick them, as you they say, then perhaps that will come to that. But me, not very familiar with how they do that. I just know that experimental drug, definitely they need you on their side. There's no questions about that. But if not something way, they no say like this, they say so. At some point, breast cancer being get a drug or maybe a medication where they no say it extend people in life for 6 months or something. The government no agree for approval at the NHS. Because what you do, then take and say 6 months, not a good value for money. So they may stop that and drag them food. In the end, I think at some point they relent or they allow for some people, and it worked, you know, for them actually. So then therefore actually go through an assessment when that go actually determine whether they will do that or not. You see. What else we get for say on that? Now, clearly, it's important for make we come and talk about Gentri. And so we're really grateful to you for share this your personal, though be, you know, hurtful, you know, story, as it were. But as you say, he lived for some time, you know, long years where he lived for. But one thing what I can get for tell you is that if not incidental finding, it's not just Papa God in your work. But most of the time, if you say you not smoke, I want you to understand, so not to just smoke or tobacco leaf, now they cause lung cancer. I don't see people who smoke for 40 years, they don't get lung cancer. People in the way not smoke, then get lung cancer. The question here is whether the lung, the cancer itself now from the lung or not, on a good day. So you have to find out whether it's primary or secondary or tertiary or whatever they call it, you know. And then, of course, you then need to know who's kind, the aggressive one or not. But if, in particular, like for example, in the liver, if the cancer there in a particular area in the liver where they the outside, not to the center, then can do the operation and remove that, and the liver will grow back. Likewise, the lung, if it's there in an area where you're not in the middle, because if it's in the middle of chest, then you go transfer to the other side. But if you're there on one side and you're bottom, then go actually assess them and decide whether this person due for let them do this operation, whether they go do a lobectomy, where in a part of the lung, or then go do complete pneumonectomy, where then pull the one lung, and then the other one can actually help the person. So, I mean, if you want, we can talk, you know, in details, maybe offline, and then we go see how we go. But thank you so much, and I'm glad to say you recognized me from last week. Thank you so much.
Thank you very much, Dr. Kamara. I take the last question from Ashraf, and because of the time, normally we can finish at 30:30, but this doesn't seem to be a hit, a topic where a lot of people we get a very good turnout, but also people take massive interest, which is a massive thank you to now. So Ashraf, now the same thing about way most of we can say. If you find out, okay, I don't take the chance, I don't play the lottery. And they pray say the winning number for BC I not get what I go test for. But unfortunately, if you get them, he say if he advisable for let them tell the person say because sometimes, to be honest, I've been talking the same thing to somebody. It was 2 nights ago. I believe come on. Now they say yes. I say sometimes the way they can tell people they get certain illnesses, the mental side of they can teach the physiological side, but the mental side sometimes they leave that behind because sometimes the mental side that can kill the person. So they say if somebody they don't diagnose and say you get cancer, sometimes maybe it's best to not tell the person, at least for give the person a better chance for live longer. What's your take?
Yeah, right. I don't know. I think I know this Ashraf, my younger brother in America, if I'm not wrong. Yeah. The problem here is this. The law, if you go by legal parlance, definitely you need for notify the patient inside England. Yeah, they need for know. The issue here is when they make them know, obviously, you're not going to make them know on their own. It's fine for like get somebody. We deal with them, family. People who go for look after them. Maybe picking them, wife, husband, or whatever. Then get for them for take the blow, the shock. But they need for know. That's not the legal side of things. Now, that said, I get somebody who I know where himself, when they get for find out, in fact, he did in well one, nothing not do one. Now they find out say he get stoned and gallbladder. He become jaundice, yellow. Now then go do the scan and find out say this man get this stone. They confirm say yes, I'm a younger brother, yeah. Yeah. So this man then go, they say then schedule him for surgery. Then go do the surgery when the keyhole. Now when they pull the gallbladder, now they find out say this man gets a very rare, very, very, very rare form of gallbladder cancer. Okay, this is where the problem came from. So this man, now the doctor tell and say, I tell you what, he said, I need to sit you down. Next week, he say, I need your family around and all that. Say, what's happening? Why you need the family? He say, well, no, I just need to tell you this. He say, one, so when the family get that, now he tell them, he say, I tell you what, unfortunately, we go pull one thing, we go find something else. Yeah? We don't find this very, very, very rare form of cancer of the gallbladder. We go treat them, we go for do chemotherapy and all and the rest of it. He said, then they go and bug them, you go vomit and things and all that, feel tired, weak and all that, and then sometimes you go get more infection than you go get. You may forget if you don't get this thing. See, but however, I give you 6 months, and if you live beyond that, well, you're lucky. He said, but I guarantee you, why don't tell you so? This is why it become a problem. He said, why don't tell you so? Most of the patients, they tell you they get this sick. As you tell them no more, it's like you don't sign the death knell, i.e., you just don't open that gate when I didn't go. Then stop for it. Then begin worry. And when the mind sick, the whole body sick. When the heart sick, according to the religious perspective, the whole mind and the whole body sick. So because they eat and you don't get nutrition and things like that, well, like that, things will begin to get worse. And so on a downhill trend. So now you ask the question, I suppose for tell them why or not. But if you don't tell them, now you lucky say the family they on board with you, then you go get away with them. But if you don't tell and say you get cancer and then you end up die with cancer, well, then can come and successfully sue you. So the law is that you need for make them know. Now salon, I don't know if they will do that or not. I can't tell you that because I don't want to work in a salon. But I know for certain that in England, any of my colleagues they go tell you say the law is that you get for make this person know. I hope that clear.
Thank you very much, Dr. Kamara. Dear me fumble them, I know say when I get plenty more questions, but we don't share the phone number for owner with you in the WhatsApp group. Please feel free for reach out to that number, the personal, if you want to talk about things on a personal level. I will pass the number to Dr. Kamara and we'll go have a conversation. But for the for time restriction, we get for finish now. So they can't go around the team. For letting tell the last word and let me close for today. The first person will go to Dr. Rashid.
Fambuda, una thank you for coming today. Dr. Kamara, plenty thank you for this ever important topic we don't present to Fambuda today. cancer dey all over the world. And as Dr. Kamara say, pikin o, old person o, man, woman, everybody can get cancer. So do ya wanna help scatter the word, because well body better pass Gentri. Una thank you.
Thank you very much, Dr. Rashid. Next person, my own person, Dr. Bell. Dr. Bell, do a big touch a little bit about the Bella woman demo and picking them and stuff. Let people, just give them a little overview. I know see we don't touch on this before, but for people that way, at least if you plan the answer to the one we don't see before. So yeah, okay. Dr. Bell, over to you, sir.
Thank you. Yes, Dr. Kamara, thank you very much for that topic today. It's very important for make people get that awareness day concerning generally concerning cancer. But also, we don't do a lot of topic concerning different cancer. Then we don't do cervical cancer before. We can send the link then to people and then see the link. But Sierra Leone, they do a pretty good job. They're not rich daily, but they do a pretty good job concerning screening and also vaccination. I sent a few article to the group. I was sent also to the Facebook group for make them get the article in because they actually try for doing a good job. And I'm glad you say they tackle them because cervical cancer and one of the cancer that we actually able to prevent. And the other one that you can try for detect them early. But cervical cancer, if you're able for get the vaccine, if you're able for do screening and then the changes na the cell then na the cervix, you can actually prevent cervical cancer. So at the salon they do a very good job in that as well. Bella woman then definitely can get cancer. So I'm saying can get cancer during the pregnancy or before the pregnancy. And breast cancer and also cervical cancer. They can always one for treat the women them as well, even when they're pregnant. But definitely they can't be, if they go for the chemotherapy, they go for wait until the pregnancy is done. But definitely even the Bella woman is supposed to go for screening as well. Woman in a salon, people always feel say we they go to doctor we're sick, but it's also good for go to doctor even if you know you feel sick for screening because screening is very very important. Concerning insurance, when we talk about somebody mentioned insurance and salon, and also since 2012, and they try for create something as salon, but 30 they not materialize it. And the only way I think say something for materialize in salon so if like the car insurance or mandate because with the car insurance now if you get motor car now you go you pay insurance for the health insurance it's very very difficult for doing that kind of way but if they attach them to something where each and every person they use in a salon, yeah, that could help. But for make that kind of system, you need cooperation from different sectors in the country. But that the one way down there, I think say they were able for do insurance and salon, they attach them to something where almost everybody they buy in a salon, and the thing where almost everybody they buy in a salon top up, for instance. Yeah, or electricity. So you have to
just want to top up. If you link out to top up, man, I'll get you.
Yes, you link out to top up, and you just call them basic health insurance, and then. But I say that just an idea, and I think a lot of people don't talk about that as well. But I say from 2012, they talk about that. But the hope and pray say, in a long process. I mean, look, America. With the Affordable Care Act, where then again get them problem and get them problem and so it's not easy for set up something like an Andy, but so the hope and pray say government is still look into it and it will be a bipartisan thing, you know, to one party or the other party for be something where everybody for look each and every party for look and one for implement. prevention, and Dr. Kamara talk a lot about prevention. And one thing I'm not sure if you mentioned that, but you get some people there where you always want to get like skin, and they can rub cream for get like skin. Then they increase the risk of skin cancer. A lot of people that don't know that but then they cause black people because the white people get prone for get skin cancer than black people But them people there where they rub cream for make the light, the skin light, the risk the higher. So please, 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 if you do something like that, I will advise you for stop. Because well body better pass fine body.
Thank you very much, Dr. Bell. That's a good one. That's a
I like that.
brilliant.
That's very good.
I like that. I'll go Tifa one day. Isata Fuller.
Doctor, don't make an afraid. That means we were yalla.
No. I thought what they want there, not the one with the yalla. I thought what they want there way they rub the cream for yalla. That are two different things, than they.
Oh, not to the yalla. Okay.
Not the
I said that they say that the one doing a washi wawa.
Oh, okay. Thank you so much, Dr. Kamara, for such educational talk. I learn a lot. So I don't get much to say because you don't really say everything. The only thing where I get emphasize on is, when I use the people for use the facilities the way they get. Dr. Bell posts something at the forum where he say all 16 districts they get, portals or hub them for do screen cancer, cervical cancer, which is very, very good in Sierra Leone. So I think say people have to really pay attention to that because as Dr. Kamara say, if they catch, some of these cancers very early, they can able to do something about it. So demand the within a year. Addition, una tell una wife there, una sisters, una neighbors, una family, Norman, be aware because I think say people at times they're not keeping aware so much about this. Then Lord, pay attention to with diets and exercise. But it's a very, very good talk. And well, Bɔdi Bεtεh pass Gentri. Thank you everybody for your listening.
Thank you so much. Auntie Nafi, if you deal with me.
Yes, Simo. Well,
Yes,
thank you so much. Thank you so much, Dr. Kamara. A very informative session, a good refresher for me. And I just want to tell everybody we're joining. Thank you for sparing their time. I would say when I find the session very useful. Just like we Dr. Kamara talk, screening. People for make use of screening. If screening services are available in the country, use ID, access the service. It's very, very good for help for identify any problem quick and so they go for get help. So now that's just what I got for say. Thank you, everybody.
Thank you very much, Auntie Nafi. You really don't sound well. May God give you good medicine. We will talk about that in the offline, okay? But thank you very much. I hope I don't left anybody. Dr. Kamara, last word for me, please.
HRH do.
I not say the day before, but I don't see again. Auntie Doc. I don't see again. I don't know if you change your phone. Okay. Well, Uncle Doc, you go first while I try to figure out.
That's okay. Which one. Yeah. Anyway, people, when I thank you, as I say, without Una, we not go there, we say we do so because as TM don't say, now 6 years we don't rob so. Like play. And we're grateful for our support because if we not get the audience, there's no way we'll go forward. So we look forward to bigger and greater things. And what we need now, as we have to do already, for spread the word, for pass the word. If we don't enjoy this like I'm going to do and so. And today, now, if you look at what we don't do, clearly we're not happy. And I make we day up to now because normally 1.5 hours, but now 2 hours we're up to now. So clearly, a very good topic, important, and it will save lives. There's no questions about that. From Australia. Wow. Subhanallah. Thank you so much, my brother. Big shout out to Ashraf, to my brother Santiki Taroli, to brother Zeke, and to Denisha, and to everybody else who don't join. Yes, I'm grateful to that. And as it is, I don't need to tell you now. If we don't know, say, well, Bɔdi better pass Gentry, then listen to Denisha in story, and you will see what they talk about. It's clearly important to say, if you get well Bɔdi, you get Gentry. But if you not get well Bɔdi, you Gentry all go pull upon you, go finish, and you go to poverty. So look after yourself, on our health, and spread the word so that the other people in way nobodies go know and then go benefit. Well, thank you so much. God bless you.
Thank you very, very much, Dr. Kamara, and everybody at the panel, everybody will join. Plenty, thank you. I don't think say need for say anymore. I think the doctors don't say everything they need for say. The only thing I will say no one what is statement we all know. Prevention is better than cure. As soon as when you get to that stage, you say you don't diagnose you, it does down to Papa God no more let God make you get medicine, But even when the medicine it's very expensive. And even when you don't pay all that money, also there's no guarantee. So dear, if we get away for all prevent, then a lot try for prevent them. For maybe we get on our bloodline, we try for get diagnosis, go for the testing and screening and stuff like that. We'll find out early, at least to be able to deal with them at that early stage there. Okay. But like what Dr. Kamara say, yes, we don't learn beaucoup, but also let we end on a nice note. Dr. Kamara say, as a doctor in England, if they find something per you, then get the right for tell you. So myself, as part of the well Bɔdi motto, a person get beaucoup sense, I get right for tell them. Plenty, thank you, Dr. Kamara. You say if you get beaucoup sense. We family until we meet again. Good night. Well Bɔdi better pass Gentri.
Hi. Thank you.
Thank you so much.
Thank you.
I'm humbled and grateful. Thank you so much.